Nerves play a vital role in transmitting nerve impulses, regardless of their location in the body. These impulses enable the body to perceive and respond to various stimuli, conveying both motor commands and sensory information. Coordinated movement and proper functioning of the body depend on the transmission of information between different body parts and the brain. Coordinated movement of the lower limb for locomotion relies on the nerves that innervate the anatomical structures of the lower limb. These nerves transmit signals from the brain and spinal cord to the muscles, enabling voluntary movement and control. The obturator nerve is an important nerve in the lower limb, providing innervation to specific muscles and areas, contributing to various movements and functions. As mentioned before, it is a branch of lumbar plexus. The obturator nerve is created by the ventral rami of spinal nerves. Its root value is L2, L3, L4. After its formation, the obturator nerve descends through the fibers of the psoas major and emerges from its medial border. It then travels posteriorly to the common iliac arteries and laterally along the pelvic wall towards the obturator foramen of the pelvis. To enter the lower limb region, specifically the thigh, it passes through the obturator canal, which is formed in the obturator foramen by a section of the obturator membrane. After passing through the canal and entering the medial compartment of the thigh, the obturator nerve splits into anterior and posterior divisions. Here in this illustration, if you look closely, you can spot the anterior and posterior division of the obturator nerve. We can also use this simpler diagram to show the anterior and posterior division of obturator nerve more clearly. Here you can also see how these divisions are responsible for innervation of different muscles. Let's take a closer look at the anterior division of the obturator nerve. This division takes a downward path in front of the obturator externus, with only a few muscle fibers separating it from the posterior division. As the nerve continues its journey, it passes behind the pectineus and the adductor longus. Here both these muscles are cut to show the course of the nerve clearly. You can also find the adductor brevis here. The anterior branch passes in front of this muscle. The anterior division is also in front of the gracilis muscle, as you can see here. Here's something interesting. The anterior division not only passes along these muscles, but also gives off a branch to innervate them. Additionally, the anterior division gives a branch to the hip joint. Below the lower border of the adductor longus, it supplies a twig to the subsartorial plexus. And guess where the anterior division of the obturator nerve ends? It supplies the femoral artery in the adductor canal. Pretty cool, right? Now let's take a closer look at the posterior division of the obturator nerve. It is closely related to the anterior division and has a similar course. This division enters the thigh by piercing through the upper border of the obturator externus muscle. Then it descends behind the adductor brevis and in front of the adductor magnus. The posterior branch gives branches to various muscles. These muscles include the obturator externus, the adductor magnus, and the adductor brevis, if not already supplied by the anterior division. As the posterior division continues into the adductor canal, it becomes a thin genicular branch. This branch then enters the popliteal fossa and pierces through the oblique popliteal ligament. Finally, it ends by supplying the capsule and the cruciate ligaments of the knee joint. Some of its fibers also innervate the popliteal artery. See how the obturator nerve supplies both the hip joint and the knee joint. The anterior division gives a branch to hip joint, while the posterior division to the knee joint. So, there you have it, a brief overview of the course and functions of the posterior division of the obturator nerve. All the muscles that we have talked about so far are innervated by the obturator nerve, meaning that's the motor function of this nerve. These muscles are muscles of an adductor or medial compartment of thigh, meaning the motor innervation of the obturator nerve is responsible for adduction of thigh. As for the sensory supply, the cutaneous branch from the anterior branch supplies the medial upper thigh. An easier way to remember the motor innervation of the obturator nerve is to use a mnemonic to remember all the muscles it innervates. Use the sentence: add 3 ounces of grape and pineapple juice. Each capitalized letter represents the name of the muscles we talked about till now. Add 3 inches to show the 3 adductor muscles brevis, longus, and magnus. O is for obturator externus. G is for gracilis. And P is for pectineus. You do remember that at the start of the video I told you we will continue this video by answering these questions, right? So now that you are familiar with the nerve, its course and function of obturator nerve, let's talk about some associated clinical conditions. Damage to the obturator nerve can occur during surgical procedures involving the pelvis or abdomen, such as during hysterectomy or prostatectomy. The nerve can also be subject to damage during total hip replacement surgery. Other than surgery, other risk factors include pelvic fractures or dislocations. Prolonged pressure on the nerve during prolonged sitting or lying in a position that compresses the nerve. Symptoms may manifest as numbness and paresthesia along the inner side of the thigh, as well as weakness in thigh adduction. Patients may also experience sensory loss or abnormal sensations in the medial aspect of the thigh, knee, and sometimes the upper calf. One of the telltale signs of obturator nerve damage is the patient's inability to cross one leg over the other while sitting. Alternatively, patients may experience difficulties with posture and gait due to the loss of adduction function. The loss of adductor muscle function can result in an imbalance of the center of gravity. The adductor muscles play a significant role in stabilizing the body and maintaining proper alignment during movements. When the adductor muscles are compromised or weakened, it can lead to difficulties in maintaining a stable center of gravity. Engaging in exercises and training specifically targeted at the adductor muscles after nerve damage can indeed lead to improvements in muscle function. Physical therapy and rehabilitation programs often include exercises that focus on strengthening and retraining the affected muscles. Due to the fact that the obturator nerve provides innervation to both the hip and knee joints, there is a possibility of pain referral between these joints. This phenomenon is known as referred pain. Referred pain occurs when pain originating from one area of the body is perceived in another area that shares nerve pathways. In the case of the obturator nerve, if there is an issue or injury affecting one joint, such as the hip joint, the brain may interpret the pain signals as originating from the knee joint due to the shared nerve supply. Similarly, pain originating from the knee joint may be felt in the hip region. So overall, you must see how important it is to learn about this important peripheral nerve which is responsible for the innervation of lower limb muscles that adduct the leg at hip joint.
Have you ever heard of video books? sqadia.com is delighted to present video books, medical books that have been tailored into a series of videos sqadia.com videos are presented in the same order as the book's chapters. Explore now and make your learning easy.